Hi everyone, welcome to the next video on calculation of anesthesia charges. First, let me explain what is this calculation of anesthesia charges. In our CPC exam, sometimes we get a question like calculate the anesthesia charges for the particular patient. Like that, they will give a question, but there will be so many details that are given in addition to the question. So what all things should be there whenever we are calculating these anesthesia charges? So now in this Find a Code website, you can find all the details regarding calculation of anesthesia charges. With the help of that, I'm going to explain it in detail. So first thing is, in the question, there should be something called as base unit. That base unit is a value for a particular surgical procedure for which you have given the anesthesia. And also there will be anesthesia time. Anesthesia time will not be directly given, but we have to calculate it. So how we are going to calculate that anesthesia time, I'll explain that later. And also in the question you have to check for physical status modifiers, and if in addition to that, if there is any qualifying circumstances situations. All these four things will help you to calculate the anesthesia charges. So we will see them one by one. Now we'll see an example here. In this, they have given the base unit for the procedure code 00820. It is 5. And the time or the anesthesia time in units is equal to 3. How did they calculate that? Usually in your question, they will say that anesthesia was started at, or they will use a word anesthesiologist prepared the patient at. For example, I say that anesthesiologist prepared the patient at 8 a.m. in the morning. Then the patient was shifted back to the PACU after the surgery to the post anesthesia care unit. That was done at 8:45. So in this situation, total anesthesia time is 45 minutes, but you have to convert it into units. So now we will see how we got that 3 units. So if the total anesthesia time is 45 minutes, if you divide it by 15, you will get 3 units. And sometimes they will use a word increments. That is also referring to the units only. So 15 minutes is called as an increment. So with the help of this, how we are going to calculate the anesthesia charges. So now let us move into the calculation. How we are going to calculate the anesthesia charges. First thing is, you have to add the base unit with anesthesia time in units. So in example, we had 5 as the base unit and 3 as the anesthesia time in units. So add them together, it will become 8. And after that, in the scenario, you will be given the conversion factor. Conversion factor is a fixed dollar amount which will be every year published by the CMS. So here they say that the conversion factor is $21.12. So now what you have to do is multiply that conversion factor with 5 plus 3. So that is 8 into 21.12. With this you can calculate the anesthesia charges. In addition to this, if there is a physical status modifier or a qualifying circumstance, that will also add up the base unit value so that we can get more anesthesia charges or more reimbursement for anesthesia. So now we will see the values for P1 to P6 modifier. P1 and P2 modifier, we don't have any specific value for it, but P3 is giving us 1 base unit. P4 is giving us 2 base units, and P5 modifier has got a base unit value of 3 base units. So with the help of these, you can also add up more reimbursement. Same like the physical status modifiers, qualifying circumstances codes. 99100 has got base unit of 1. 99116 has got a base unit value of 5. 99135 has got a base, 99140 has got a base unit value of 2. In my previous video on anesthesia guidelines, you can check the meaning of all those qualifying circumstances codes and physical status modifiers meaning. But this is how we calculate the anesthesia charges. And other modifiers regarding the number of patients that are treated by the anesthesiologist, and also the CRNA related modifiers are just informational that will not add up any value to the procedure. So those modifiers will be just reported in addition to the CPT anesthesia codes to say that we have done some modifications. Now let me discuss a question, and with the help of that I'll explain you how we calculate the anesthesia charges. The first question what you're seeing here is Code 00350, anesthesia for procedures on the major vessels of the neck, not otherwise specified, has a base value of 10 units. Patient is of P3 status, which allows one extra base unit. An anesthesia start time is reported as 11:02 a.m. and the surgery began at 11:14 a.m. Surgery finished at 12:34 a.m. and the patient was turned over to the PACU at 12:47 a.m., which was reported as the ending of anesthesia time. Using 15-minute time increments and the conversion factor of $100, calculate the anesthesia charges for this scenario. So now first thing is we have to calculate the anesthesia time. So what is the anesthesia time in this question? Anesthesia was started at 11:02 a.m. and anesthesia ended at 12:47 a.m. So there are actually total of 1 hour and 45 minutes. First thing is you have to convert it into 15 units. So in 1 hour 45 minutes we have got 7 units. So anesthesia time in units for this procedure is 7. And what is the next information that is given in the question? Base unit is 10 units. So now we have calculated the anesthesia time. It is 7 units. And also they have given that there is a P3 modifier. So you can use one more base unit. So now we will do the calculation for anesthesia charges. So here base unit is 10 and we have one more additional base unit that can be added up, and also anesthesia time in units is again 7. So add them together. It's 10 plus 1 plus 7. It is equal to 18, and that should be multiplied with the conversion factor to give $1,800 as the answer. So for this particular question, the answer will be 1,800. This is how we calculate the anesthesia charges. So don't forget about the extra allowance of base unit. That has to be always added to the base unit so that you will get more reimbursement. So this is how we have to calculate the anesthesia charges, and when you are calculating it, don't forget about the extra base units, because if you forget that, the answer will become $1,700. So don't miss that. This is how we do the anesthesia charges calculation. One more question is there in this video, so you can try to solve it and post your answers in the comment. And also please subscribe my channel to view more updates about the medical coding. Thank you.